everyone, and welcome to once again, our town hall, our staff town hall. It's great to be with you here today. My name is Hallie Nicholson. I work in Campus Human Resources as your HR Strategic Communication and Engagement Manager, and I'll be your moderator today. So we've got a great group of panelists on hand to answer your questions. As you'll recall, we asked you for your questions during registration, and you can also submit your questions here today using the Q&A function. Because of the volume of questions we get, we likely won't be able to answer them all, but what we will do is put them on the Return to Learn site following the event. Another note that I want to make note of is that this webinar has live closed captioning available in two ways. So you can look in the chat and there will be a link in there. First, you can click on the closed caption button at the bottom of the screen and select show subtitles, or you can click the link that was just pasted into the chat. So without further ado, I would now like to welcome Chancellor Pradeep Khosla for some welcoming remarks.
Thank you, Haley. Good afternoon and welcome everybody to this staff town hall. When we expanded our multi-layered Return to Learn program this fall, we had reason to believe that it would be successful. And I'm happy to say that our success so far has surpassed our planning assumptions. Throughout the fall quarter, you, our staff, adapted and flexed to help ensure that UC San Diego was a safer place for our tribe community. You supported our faculty and our students by changing our campus landscape visually and functionally to support our new reality. You saw a challenge and responded by seeing what was possible rather than what could not be done. So the results of our Return to Learn approach show, without a doubt, that your hard work contributed to our success. Our campus has one of the lowest numbers of COVID-19 cases in the country. Since March 1, we have conducted more than 85,000 student tests and more than 21,000 employee tests. We have expanded our wastewater testing from 6 to 52 sampling sites, and we are adding more for a total of about 200 across the campus before next quarter. We have increased support to faculty and students for remote learning. We have constructed outdoor classrooms with a full complement of technology aids for in-person and hybrid instruction. And we have closely followed guidelines for masking, physical distancing, and sanitation. And we have consistently screened, tested, and sequestered when necessary. Our Return to Learn approach is working. From October 1 to December 13, the 14-day positivity rate for UC San Diego students on and off campus has averaged between 0.12 and 0.86%. During that same time, the positivity rate in San Diego County has averaged between 2.7 and 8%. Consistent participation across our Return to Learn strategies throughout the fall quarter has made our campus safer, I think, to say than San Diego County. From the beginning, you demonstrated leadership that has helped make our university a model for other universities and schools nationwide. And here, at the end of the fall quarter, I can look at each of you and say, thank you, thank you, thank you. Thank you for rising to the challenge. It has paid off, but our work is not done. We cannot let down our guard. It is important than ever that it is more important than ever that we continue to wear masks, wash hands often, and avoid unmasked gatherings. So complete your daily screenings and regular testing, which, by the way, is once a week now. None of this could have worked without your support and your commitment. You are integral to our UC San Diego's continued distinction, prestige, and success. So thank you one more time, and I hope you enjoy the upcoming break. And in the meantime, please enjoy this town hall. Back to you, Hallie.
Great, thank you, Chancellor Khosla. Next up, I'd like to welcome the host of our town hall today, Nancy Resnick, our Chief Human Resources Officer, to share some thoughts.
Thank you, Hallie. Thank you, Chancellor Khosla, and good afternoon, everyone. I'm Nancy Resnick. It's my great pleasure and honor to serve UC San Diego staff as your Chief Human Resources Officer. And I appreciate you joining us. I see the number of participants is going up and up, and I know we had 1,000 people or so registered for this town hall, our final staff town hall of 2020. So it is great to have the opportunity to connect virtually with everyone. I'd like to share an update that you may have seen in last week's campus notice from our Chancellor. And I'm very pleased about this, and I'm very pleased to share this with you if you haven't had a chance to see it. Campus staff working remotely can continue to plan to work remotely through at least the end of May, so May 31st, 2021, unless you're told otherwise by your supervisor or vice chancellor. So we know how important social distancing has been. It's been a very effective and important tool in preventing the transmission of COVID-19 and an effective strategy as part of our successful return to learn program. So those staff who have been working remotely, please know that by doing so, you are actively helping to protect the health and safety of our students, of your colleagues who are working on campus, and of our community. So thank you. I believe that this extended timeline will be helpful as we look to make decisions and plans for the coming year, particularly around planning related to things that are going on in your personal life, with your family. We're very mindful of challenges that may arise with extended work, particularly where employees are balancing caregiving responsibilities, distance learning, and all the myriad things that we have going on when we have remote work at home. And I think it's particularly important given the kind of mix of responsibilities that arise with remote work for supervisors to be particularly flexible and collaborative. And I encourage supervisors to be flexible and collaborative with staff. So I think, we all know this year has been challenging and unprecedented. We've really been through a lot together as a community. And part of that has allowed us to grow in incredible ways. So I will say this truly, it has been awe-inspiring to see the ways staff have come forward in a wide variety of ways and have risen to the challenges that we've encountered during 2020. In my recent message last week, my updates from your CHRO message, I asked you to share what you've been particularly proud of in 2020. And I really want to say thank you, and I appreciate the many people who did offer contributions in response to that invitation. It was truly inspiring to read about all of the wonderful things that have been accomplished. And I'd like to take a moment or two to share just some representative quotes that I believe are perfect examples of the ways staff have succeeded this year through innovation, hard work, and resilience. You'll see the more detailed quotes on the screen, and I'll kind of summarize some themes. So some of the main themes that we heard about and some excerpts, we quickly and creatively shifted a significant amount of events and programs to virtual platforms. We've taken on new opportunities to work outside our usual roles or areas, flexing new muscles and growing professionally. We've modernized our work by reducing and in many cases eliminating paper processes, which is not only more efficient, but also more environmentally sustainable. We've continued to strengthen our commitment to diversity and inclusive excellence across campus. So there is so much to be proud of here, and these are just a few examples of the major accomplishments that staff had shared in response to the message, and there is so much to celebrate and be extremely proud of. As 2020 comes to a close, I'd like to encourage you, please take the opportunity to pause and to acknowledge the incredible contributions that you have made and your colleagues have made over this past year. On behalf of senior campus leadership, please know how deeply grateful we are for all you do for UC San Diego. We see your hard work and we value all that you bring to our community. We'll likely still be facing difficulties as the new year begins, but at the same time with the vaccine on the horizon, we can see a light at the end of the tunnel. And looking to the future, we have huge opportunities to reimagine our workplace and consider ways to infuse more flexibility into the staff experience in particular. We'll continue to talk about this as a staff community in the new year. So please keep an eye out for opportunities to share your voice and your concerns. With that, let's get started. So thank you, and back to you, Hallie.
Great. Thank you so much, Nancy. So now we'll jump into the update portion of our program today. And I'd like to first welcome our first presenter, Dr. Angela Scioscia. Angela is the Interim Director of Student Health and Wellbeing Services, and she's going to give us an update on kind of the state of the pandemic and what some of the numbers are looking like.
Thanks, Hallie. I wish I had some better news here, but we have to face the harsh reality of where we're at. And we will be in this space for a while. We haven't turned the corner yet. And I think we all need to be very mindful of this as we go about our activities in our personal and professional lives. So you see here the California pattern. We were really doing pretty well this fall, and we were all encouraged, and we thought we were going to have a relatively quiet holiday period. And you see a dramatic change, an extremely dramatic change that began in early November, continued right through Thanksgiving, and continues on the rise. This has led to the Governor Newsom's stay-at-home order. We had to take another action, similar to the action we took months and months ago to really shut down many services that we had opened earlier in the fall and were optimistic could stay open, but it realistically could not. And we've seen the strain on our healthcare systems. Next slide. So in San Diego, the picture is very similar to what you saw in California. All of a sudden, November, a very dramatic steep rise. We have not yet plateaued. We were at about an 8.2% positivity rate last time it was reported yesterday. And then we see here 109,000 of our San Diegan citizens have been diagnosed with COVID-19. So striking numbers, many new cases each day. And again, we have not yet plateaued, so we need to be mindful. Next picture. So I want to share a picture of our dashboard. I encourage all of you to go to the Return to Learn dashboard, which is available to everybody. It's updated every day, has lots of great information. This is just a piece of it. And you'll see this positivity rate, which reflects the striking number and rise in the county. And you see our number below for the students in blue, slow and steady. Beginning again in October, we're 0.1, slow and steady rise. We actually on the students look kind of stable right now. We see the rise in the employees, looks kind of stable on the employees, so we're optimistic. But again, we have to watch this very carefully. So unfortunately, the rise in the county, we did see a little bit here, but we remain in a better position, I think, because of our strategies. And Pierre Ouillet will be the next person speaking. He'll give you some of the background of the principles of the strategy that has helped us stay in this good position. So next slide.
Hi, everyone. Just a reminder that we keep using a similar framework that has served us quite well so far. So the three pillars, the usual ones, focusing on viral detection with a lot of testing. The Chancellor mentioned how much we have carried out since the beginning of the pandemic, well over 100,000 tests for students and faculty and staff on the campus side alone. A very large rollout of the wastewater monitoring. And again, the more wastewater samples we have, the more precise we can be in detecting the origination of the virus. All of that, of course, very much informed by ongoing modeling from infectious disease experts. Everything that we do is grounded in science here. And again, their models have been incredibly precise and predictive. We continue to do a great job on intervention. We have significant contact tracing capabilities. I'll come back closer to the end of this presentation to talk about the COVID Notify app, which is a tremendous asset in our arsenal right now. And we continue to have significant availability in our isolation and quarantine housing, with about 15% utilization of the rooms right now. So we are in pretty good shape. I will mention one more time the very close collaboration with the county, which is key to our success. And a reminder that risk mitigation starts with the basics: face covering, physical distancing, and we continue to make sure that our facilities are clean and properly configured for COVID. So that's my high-level update. Angela, back to you on the viral detection piece.
Sure. So we'll go a little more into the details about these really important steps for detecting the virus, because by detecting the virus, we isolate individuals who might be shedding the virus and slow down the spread. First step, the daily screening. Please keep doing your daily screening. Remember, you'll be asked 3 basic questions from those. If you have any symptoms, red thumb. We want you to stay at home. We want you to get a symptomatic test. There are multiple testing sites throughout San Diego County, as well as on the campus. We have the Price Center and Athena Circle. So take advantage of testing. The COVID line, if you have symptoms, they will call you. You will be able to self-schedule for a convenient appointment within 24 hours, and you'll get your results back within 24 to 36 hours. If you have been exposed to someone who has COVID-19, or there's someone in your household with COVID-19, you are going to have a yellow thumb. Again, this means you stay at home. The COVID team will give you instructions. We'll want you to stay at home. And there is some change in this policy if you've been keeping up with things on the CDC and Scioscia. So the CDC is allowing a 10-day period if you have a COVID-19 negative test, which is what we're doing for our students on day 10. Scioscia is still going with a 14-day period for employees. So for now, the quarantine remains for a 14-day period. We do want you to get a test, though, on day 5 to see if you've converted, and then you would go to isolation instructions for someone who has COVID-19. If you don't have symptoms, you've not been exposed, you've got a green thumb, you're going to go ahead and you're good to go. Come on to campus and do your work if you're working on campus. I'm going to go in a little more detail on the next slide about wastewater. And the wastewater, why we do it is because people start shedding virus before they have symptoms for a few days. So they shed it. They can shed it by coughing, sneezing, their respiratory tract, exhaling, or they can shed it in the feces. So by looking at the waste stream, we can pick up individuals who are shedding in buildings sooner than they may know by symptoms. This has been very effective in our picking up individuals and encouraging them to go for testing. Sometimes they've had a test within a few days that was negative. We get a wastewater signal, and 3 days later, their test is positive. So please pay attention to the wastewater signals. I know it's challenging, but folks' status can change very quickly. So we're trying to make more targeted messages. As folks have mentioned, we're putting more waste stream samplers out so that then they sample a smaller area and we can send the message to fewer individuals. Occasionally, it covers a wide area or an area with public buildings, so an all-campus message go out. When we can, we're going to send a message just to the individuals in a building, residents or occupants of a building. So with the deployment of the 200 wastewater samplers, the messages will get more targeted. So the next thing is asymptomatic testing. This has been extremely helpful because individuals, not all individuals will have symptoms. Additionally, individuals will shed virus before they have symptoms. So by regularly testing, we pick up individuals in the early phase or in the asymptomatic window for folks that never have symptoms. This has been very effective with the students, and we're encouraging it for employees as well. We want you to test every single week. Take advantage of the free testing the campus is offering through the health system. Now, there are a number of ways to be tested. You can be tested at one of the testing sites with the drive-up. They're located in multiple sites in the county, as well as on the Price Center, you can have tested by a provider, or we're starting for employees to do self-administered with some observed. The students were doing self-administered testing. It was observed by a provider. We've now transitioned the students to a totally self-administered process. They pick up a kit in a number of locations throughout campus. They swab their own noses. They drop the kit then back into a drop-in, and we get the results back. We don't have to use providers. They don't have to schedule an appointment. They can pick up the kit and they can test whenever they want. We're going to actually move to vending machines. Our vending machines are due to arrive. That's our holiday present this year. And we'll be deploying vending machines throughout the campus. So you'll just hit a button, you'll be able to get a kit and test. Now, what's really great too, is we're going to be able to offer this self-administered testing to our employees as well as our students. So I want to go through some of the steps about the self-administered testing on the next slide. So there are a couple things you need to do with self-administered testing. The identification of the sample to you as an individual is different in the self-administered process. And this is really important. We use a barcode that is on the actual sampling vial. And we go to saliva, which we're hoping we'll do in January. It'll be the same process. There'll be a barcode on the sampling collection tube, and you need to scan that into your phone. You can use an Android or an Apple phone. If you don't have that, we're going to have some iPads that will also be a way to do this. But you need the UC San Diego app, and you use your AD login. You also should be activating your My Chart. That's really important because all of our results, whether it's through the Excite Lab or the Calm Lab, so we have 2 labs that are doing the samples, both CLIA certified, both excellent in terms of their turnover times and results. It's allowed us to have a capacity of thousands of tests every single day. But all those tests are resulted through a single portal through the health system through your Epic MyChart. So make sure you've activated your MyChart. Make sure your phone number is accurate, because if you are positive, we want to call you. And it's really important that we have a way to reach out to you quickly. So you will be able to scan using your phone, your AD credentials, you scan the barcode. It gives you a symbol, a check, you can tell green that you're good to go. And then that sample is identified to you. Your results will be back within 24 hours. So we're really excited. We're going to be able to offer self-administered testing to our campus employees on a number of locations throughout the campus. And keep your eye open because these will be opening up at the start of the winter quarter. So I think the next slide, I want to speak to a little bit, just briefly. So no, we will have more undergraduates on campus than we had in the fall. As you've seen, we've done really well with the students living on campus. They've had a very low rate of positivity. They've been able to study effectively, build relationships. So we really think it's a great environment for our students. So we're continuing to have single room bedrooms only, no doubles, no triples. We'll be able to expand another 1,000 undergraduates. These new undergraduates will move onto campus, much like the others did in the fall, through a drive-through process with testing upon arrival. All of our returning students will be tested. They will be tested on arrival, day 5 and day 10. Any of our graduate students or students who've remained on campus that involved in unmasked activities or left campus temporarily will do a similar testing again. We do a lot of testing in case they've picked up virus. We want to find out about it. We want to take care of them. And then we want to isolate them, though, so there is no spread. In the undergraduate and residential campus, graduate residential spaces, we have a no guest policy and no visiting between units. The COVID monitoring team will keep an eye on things to see whether we can move to phase 2 later in the winter quarter. But I'm pretty sure we're going to start out very conservatively. As I've said, we have not plateaued yet. So I think we all have to be prepared that the restrictions that we're living with now are going to be with us for a while. Hopefully not into the spring, but I think they will be with us in January. Next slide. The other thing I want quick on the vaccines, we're super excited, all of us that are dealing with COVID, and this medical and scientific community is thrilled with the progress that's made with the vaccines. As you know, Pfizer was approved last week, and the Moderna will probably be approved this week. Both of these vaccines use a technology, it's mRNA based. mRNA, messenger RNA, is actually the signaling tool to make proteins in your body. And so we all have messenger RNA. That's how every single cell works with messenger RNA. This messenger RNA in the vaccine signals your body to make the spike protein. Your body then reacts a little bit to the protein, and there are some small reactions at the injection site as well. Some people get systemic reactions, a significant number, but they're temporary, and they are a reflection of your body reacting to that spike protein. That spike protein is not the virus that gives you the infection, but it is the protein that attaches the virus to your cells. So by getting this response, this immune reaction of the vaccine, it protects you when you're actually exposed to the real SARS-CoV-2 protein and virus. We don't know how long the protection is going to last. It's highly likely that we will need booster vaccines. So there will not be immediate access to vaccine for everyone by any stretch of the imagination. We are going to get small aliquots of the vaccine around the country. They are being distributed now. They are being prioritized to the healthcare workers, and not every healthcare worker will get the vaccine initially. It is even within our own UC San Diego health system, there is a very thoughtful and detailed plan to target the highest risk areas, the intensive care units, teams, the emergency room teams, and not everyone in those teams will be vaccinated at the same time. They have created a plan for the acute care space, the hospital space, because if any of us becomes ill, we need to have those hospital resources to take care of us. It will then expand to the ambulatory space, the primary care providers, the urgent care areas. Then there will be movement into other areas of the community, including the campus community, essential public workers, the police, transport folks, all kinds of folks. There will be a complex plan of vaccine delivery. On the campus, the chancellor will be appointing a small group of individuals. If we're lucky enough, and we do anticipate we'll get vaccine, maybe not, probably not in January, but a little later on. And then we will have an allocation process with a thoughtful plan to distribute, to bring the most benefit, to target those individuals at greatest risk. So there'll be a lot more evolving about the public process, the campus process for vaccine distribution. As soon as we're safely able to, we have access and we can give it to folks, we want to vaccinate individuals. So we're committed to that. There'll be more updates coming down the road, or I'm sure over the next few weeks and months. Next slide. I think I hand over. Oh, this is just a reminder of our process. I want folks to know that we have a COVID monitoring team. There's 6 of us. We meet every day. We look at all the data that's coming out of the campus, the employees, the students that are positive. We look at what's going on in San Diego. We then pass information if we think we need to take actions, change in policy, to the COVID response team. And then chancellors and other leadership then create campus policies based on this process. I think.
Great. Thank you so much, Angela. And I'd now like to welcome Gary Matthews, Vice Chancellor of Resource Management and Planning, to join Pierre and Angela on screen to share some updates about our facilities and campus safety.
Good afternoon, all, and season's greetings. I think Dr. Scioscia has laid out an excellent overview of the vaccine. And what's clear is we all have to do our part. As we patiently wait for the vaccine, we're still going to have to do our face covering, maintain our social distancing, limit our contacts, including those with family, and we'll have to participate in the frequent COVID-19 testing. What's encouraging, as Dr. Scioscia pointed out, is that there'll be additional methods. So the nasal swab, as well as some self-testing, will be available, which is truly exciting. We'll have to continue to practice good hygiene and self-cleaning our spaces. And as we return to work, thankfully, Nancy Resnick has provided an update that says we're really going to be working, at least some of us, until the end of May, unless we call back to campus. So it's a good time to continue to remember what we have been doing that's made us successful and what we need to continue. Next slide, please. Campus safety has certainly been on everyone's mind, and what we've tried to do is, throughout the pandemic, we've put signs up, we've changed signage, and what's clear is that we've been successful, but at the same time, one of our newest signs is focusing on the public health orders and having only people who are engaged in essential campus operations or attending approved in-person courses, residing in university housing, or receiving care at UC San Diego hospitals and clinics are going to be permitted on campus. We've started placing these signs across the campus, and it will ramp up over the next several weeks as we move towards the holiday closure. Not that the campus ever closes, but this is a time to transition. One of the things that I mentioned in terms of cleaning and self-cleaning, keep in mind too that the facilities management and building services group have been on the campus since the March closure, and they've been working diligently to disinfect high traffic areas, including restrooms and classrooms. They've also done electrostatic spraying to sanitize campus buildings to allow for 100% surface disinfecting. Now, we know that much of the virus is spread through aerosols in the air. However, there's still opportunity for contact if there's a virus left on a surface. So we're still cleaning at high levels, and we will be continuing to do that. 90% of the campus buildings have now been retrofitted with a higher level air filter, which is similar to a hospital grade air filter. And the remaining 10% of the buildings did not allow for that, but we've also upgraded those filters to accommodate the highest value of filtration that's available for those units. Next slide, and we will continue to do that. During the closure, and I mentioned that it's not a total closure because we've got quite a few researchers, clinicians. It's a vibrant campus, as well as residents living on the campus during the next several weeks. We will be providing through resource management planning adequate staffing to provide public safety. We're going to cover campus emergencies as we've done in the past. We will support critical research and certainly any special projects that are underway. We are intending to do what we've done in the past, but most importantly, make sure we concentrate, and we need your help. We're going to be locking exterior classroom, exterior restroom doors, and entrances will be secured. So buildings that are not open to the public will be secured. So employees who are authorized to be on campus will need to note where, what doors will be open, and most importantly, we will make sure that those interior restrooms are in fact left open. Triton Transit will begin a reduced schedule on December 19th, and a big thank you to transportation. Permit displays will not be required during the UC San Diego holidays. So I'm going to hand it over to Pierre Ouillet, and we'll talk about Swiss cheese.
My favorite, the Swiss cheese, being French. And the concept is very straightforward. No layer is perfect, but all the layers together will protect you, your community, and your loved ones. So please take advantage of the free testing. And I think what's really differentiating us as well is the rapid turnaround time. I think the county has improved, but I have a lot of friends in the committee who have been appreciating the 15-hour turnaround time average that we offer. So it's an incredible advantage that we offer as an employer. Please use it to keep you and your family safe. Add the COVID Notify app to your phone. I'll talk about it on the next slide. And please continue to do the basics as we mentioned before. If we shift to the next slide, we had a big launch last week. So we had been piloting the app at UC San Diego and UC San Francisco. It was successful, and the governor rolled out the COVID Notify app to all of California on Thursday. It was, I think, the largest launch of any app that scale, with 3 million people enabling the app on their phone kind of day one. As of today, we have over 6 million Californians, so it's about 16% of the California population. And it's an important fact because according to some models, if 15% of the population has enabled the app on their phone, that would reduce the death rate by 15%. So, and it goes up from there. So if you haven't done that, please enable the app. Just a reminder, it completely protects your identity, protects your location. And as of today, 700 people received an exposure notification from the system. So it's really working to prevent outbreaks. Thank you for doing that. And now I will pass the baton to my colleague, Elizabeth Simmons.
Thank you. Elizabeth will be offering us, Executive Vice Chancellor Elizabeth Simmons will be offering us some updates from the academic side of the house now.
Thanks very much, Hallie. So just a couple quick notes. Thanks to Return to Learn, we've been able to continue the university's academic mission really very strongly during these last 9 or 10 months. And so I'm very grateful to all the work that everybody has done that's made this possible. So for example, if we just look at enrollment, we've remained at full enrollment throughout the spring, summer, and fall. And in fact, you can see that we even set some new enrollment records, which is really very positive and a testament to how eager students are to keep coming here to learn. If we go to the next slide, you can see that our plans for winter quarter are to make it quite similar to fall quarter. We're going to be starting out with all of our in-person teaching being done only outdoors, just the same way that we have finished out the fall quarter. But we hope that a little bit later in winter quarter, we'll be able to move back to having indoor teaching as well. We have a slight uptick in the number of courses and the number of students signed up for in-person classes for the winter. And we have created, if you go to the next slide, some really wonderful outdoor classrooms to be able to offer classes even well, it's final exams right now, but even now during the stay-at-home order, we are allowed to teach in person in these outdoor tents because the air just flows through really 10 times more strongly and regularly than it does even in a hospital operating theater. So the ventilation is great. The county has no concerns about that. And people have been teaching lecture courses, seminars, and even, as you can see, a robotics course where the students build robots and then they test them on a racetrack, and they're able to do that all in the teaching tents. So we'll have the teaching tents and several support tents available also in winter, and we're building some additional tents to allow additional capacity and flexibility. And we look forward to continuing to work with the students. So again, this is all possible because of the success of Return to Learn. So everybody on the teaching side is really very grateful for all the support that the staff have given and everything that Return to Learn has made possible. Thanks, Hallie, back to you.
Thank you very much. It's really neat to learn about these outdoor classrooms and some of the opportunities they're creating. That's great. So before we jump into our Q&A portion, we've got a couple of updates about topics that we know are top of mind for staff right now. So first up, I'd like to welcome Pearl Trinidad, our Executive Director of Business and Finance, and she's going to give us an update about UCPath. Then we'll hear from Vince Kellen about Oracle Finance. So Pearl, take it away.
Thanks, Hallie. Before I start my brief presentation, I just would be remiss if I didn't start off by acknowledging and thanking the many HR preparers and transactors, or financial transactors, for all their effort in their role that plays a significant part in the livelihood of all our employees. The university, as well as our employees, owe you a debt of gratitude. So thank you so much. First update, the transactions. We see the transactions, our transactors are continuing to become more proficient in the use of the system, and the central offices are navigating the new processes and understanding how to re-engineer and work with UCPath. The system issues that we are experiencing that are top of our list in terms of our focus is we are trying to ensure that our benefit de-enrollments that have been occurring throughout the system, that we have a handle on that benefit de-enrollment, and we're preventing them from happening at UC San Diego. In addition, we're seeing some direct retro performance issues that are front and center of the corrections that are happening in January. We are experiencing some delays in response time for UCPC, and that's directly related to their staffing. They have been impacted by COVID, so we have seen delays in the response time. That being said, during our campus closure, UCPC will remain open. They will only observe the official UC holidays, and so the hours are there in front of you. Next slide, please. With respect to the support that the location or our local offices will supply you, I have provided a list of those central offices. We have a great ecosystem that is here to support you should you have issues with performing your transactions or you are not getting the response you are intending to receive from UCPath Center. This slide will be made available to all of you. I'm not going to go through each of the names, but this represents all the central personnel offices, the contact leaders in those offices that are committed to the support and escalation of any issues you may have regarding UCPath. Next slide. The last update that I would want to quickly give is regarding our W-2s. We're getting a lot of questions from employees who are taking a look at their paychecks and seeing only half their income. This is just to remind you, those employees that were employed before May 1st will get 2 W-2s, one from UC San Diego through AYSO and the other through UCPath. Please make sure that you verify whether you have enrolled in online delivery. And if you haven't, I do want to encourage you to do that. You'll actually get your W-2 earlier. In addition, if the W-2 online is not viable for you, I ask that you go online by January 15th to make any updates to your address to ensure there is no delays to your W-2. Lastly, this is the time of year when there are a lot of nefarious activity from individuals who are trying to obtain your personal information. Please be extra diligent in making sure that you're watching any emails that are asking, any phishing scams, asking for personal information. As a note to remind you, UC will never ever send your W-2 out in an attachment via email. So if you've been asked to open up an attachment, please do not do that. It is a scam. In addition, we will never text you asking for information that is personal. So again, at the end of the year, please be very diligent in the information that you receive and kind of accessing any attachments. With that, I will hand it over to Vince.
Thank you, Pearl. If you can go to the next slide, Hallie, that'd be great, or whoever's controlling. For everybody that's been involved in the Oracle Finance Project, a big thank you. There's been hundreds of people in Central Department and IT staff involved before going live and since going live. And along the way, we are continuing to learn and adapt to that system. So we recognize there's still issues and learning problems, but the good news is relief has been coming and is continuing to come along into the future. The most important thing is there's been a number of reports that have been released just recently and more coming in January. There are some department reports that are going to be available soon. Cost transfer dashboard, a reconciliation report with some summary and drill down capabilities, some PO and invoice lookup reports for procurement, and then payroll projection reports. We have links on this deck here for different places. I'm putting a link in the chat stream so you can get an idea of the report roadmap and what's coming out. And final slide. If you have any issues, there are places you can go, certainly to the Change Network or to your fund managers, as well as the different links on this site. Where you can look up what's coming down in the roadmap and where can you go for further information. There's been a big focus on additional training for the different fund managers in terms of reconciliation, financial reporting, and other aspects of Oracle Finance. So again, appreciate all the hard work everybody's been doing over the last year or so and since we've been live, and more improvements coming.
Great, thanks so much, Vince. So clearly there's a lot going on in the world right now and here at UC San Diego. So on that note, I'd like to welcome my human resources colleague, Crystal Green, who's the director of our faculty and staff assistance program, to share about some mental well-being resources that are available to staff.
Good afternoon, everyone. I'm so glad you took time to be here today and to reaffirm all of our connections. It helps so much to keep in touch with one another and to keep up on all this important information. We wanted to close out this portion of our meeting today with some reminders to you that, yes, it is extremely important that you follow everything that Dr. Scioscia and our colleagues here have said about keeping us physically healthy, wearing your mask, washing your hands, keeping your distance, taking your regular tests, of course, but we also have to attend to our mental health and our emotional health and well-being. So while there's no one answer for everyone, there are some tips here that I thought I would share from my FSAP colleagues that we've provided, and we hope you'll look into them. Maybe when you've got a little time off during the curtailment, you might even think of sharing some of these with family and friends. This is by no means an exhaustive list. It's just a little sampling to maybe nudge you towards doing something to make sure that you're also taking care of your mental well-being. Check out our FSAP link page. We have a couple of new articles there listed on one of the tabs for tips for the holidays. We hope that you'll use those for thriving through the holiday season. An especially fun one is the 5-day plan for reinvigorating yourself. that was provided by our counselor, William Youngblood, and I think that you'll enjoy it. A little something for every day. You can also think about using your medical resources, because most of our plans include a really great resource called My Strength. And you can do some online tests, you can take classes and courses and find a community there as well. And then you might also want to stay connected by checking us out on Facebook and going to many of the other UC San Diego social media apps, just to see what's going on and see what kind of fun things they're sharing and what they have on their pages. And if you want to, check out some of the free apps like Insight Timer and Liberate, Headspace, Calm, Mindshift. There's lots of free options there for you, or if you want to, there's also memberships available. But really, you can use so many of their resources for free. You can even find hundreds of music samplings and so forth that you could play while you're working out, while you're at home with your kids, doing some of your traditional holiday activities. And lastly, don't forget to try and get out and use your body, get in touch with nature. It's a wonderful way to enjoy the environment safely, of course, but to work off some of that stress and get in touch with the changing season here, get some fresh air, and not be just enclosed in at your computer all the time. FSAP will be closing during the curtailment, but if you need anything, please send us an email and we'll be sure to respond and get you scheduled if you'd like for a one-on-one or something special for your staff come the new year.
Excellent. Thanks so much, Crystal, for all that great information. So now we'll move into the Q&A portion of our presentation today. So I'd like to invite all the panelists to join me on screen, and we'll start taking some questions, both that we received in advance of the event and some of the questions that are coming in through the Q&A box. So I encourage you to continue submitting those questions, and we'll get to just as many as we can. And as a reminder, if we don't get to your question, we're still collecting them and posting them on the Return to Learn website. And so you'll find a link for that in the chat. So up first, I'm going to send this question over to you, Terri. So my question is, can you update us on the leaves that were set to expire in December? Specifically, can we continue to use leave and/or sick time for childcare in January and beyond?
So I'm going to give you the perfect answer. It depends. So the federal leaves have not been extended, but if that changes, we will certainly let everyone know. As it relates to the UC and the Chancellor's generous grant of the supplemental leave, those have been extended. So the UC paid administrative leave and the Chancellor's supplemental leave have both been extended until June 30th of 2021. So please don't make a rush on using those leaves anytime soon. Take care of yourselves and wash your hands and all of the protocols so that you won't need them.
Great. Thank you, Terri. All right, so Angela, I'm going to give you a scenario and see what you think about it, all right? So hypothetically, it's a couple days before I want to go home and see my family, and I got a negative test. I got a negative test the day before my plane leave. So am I totally safe to see them? So basically, how does this all work? We're thinking about visiting family. How does it work?
So I think the caveat to that is, what were you doing in the 10 and 12 days before you got you're seeing your family? Because if 3 or 4 days before you had been at a gathering with 20 people in which people were, sharing drinks and talking and everything like that, you may not have actually had the point of converting. So your test that you took 2 days later could be negative, and you could easily be starting to shed virus day 4, 5, or 6, just when you're seeing your family. So it's our activities in the window before we see our family that are so critically important. So if you've been very careful, though, and very diligent with your masking and your behaviors and who you spent time with, that negative test is very reassuring, and I'd feel much better about it. So we need to think about all of our behaviors in a period of time, not just a single test.
Great, that's helpful. Thank you. So Elizabeth, you shared briefly about the outdoor classrooms. So what kind of feedback are we getting from faculty about those outdoor classrooms? And there's also a question, has getting out of the traditional classroom created any new opportunities that we didn't have before?
Oh, those are great questions. So people have been very interested in the outdoor classrooms, and those who have used them have been really enthusiastic. They've also given us some frank feedback about when the AV system needed a little tweaking so we could make it, better for next time. but yeah, they're working very well. They have plenty of room and good equipment and so on. For the things that people have learned, I've seen faculty have talked about things like realizing that if they wanted to invite guest speakers into a class to talk with the class, they could get people from anywhere in the world to come, because they don't have to fly in just for a 20 or 30-minute discussion with the class. And so we have faculty who have lots of contacts with really amazing colleagues all around the world. And then those folks are coming and interacting with our students in real time in the classroom, in the virtual classroom. And so that's opened up huge new possibilities. And other people have rethought the whole way that they do tests and started doing oral exams instead of written exams, for example, and found that that can give you a whole new window on seeing how your students think about things. So a lot of creative ideas are coming out.
Very cool. And it'll see what continues to come out as we continue to move through this. So Pierre, I'm sending this next question to you. We've gotten some emails over the past couple of weeks, and we're seeing words thrown around: curtailment, furlough. There was a letter recently from President Drake. So my question to you is, can you clarify what will be happening at UC San Diego? And then Nancy, I'm also wondering if you might be able to offer a little bit of definitions on some of those terms that folks are hearing.
To keep it really simple, the answer is nothing. What the UC framework asked every campus was to demonstrate that they would weather the storm. And the storm is primarily the cut in state funds that we have experienced. We have done really well on kind of research, enrollment, and so forth. But we had a very significant cut in the state funding, which we're working to restore, but we're not there yet. And we needed to mitigate this. So we have the need through attrition. As you know, we kind of froze positions very early through the pandemic. We had a lot of folks retire in June. Many positions have not been replaced. And by keeping these openings, we were able to avoid layoffs. And that's how we will meet our target. So that's why the Chancellor came out a couple of weeks ago and made two announcements. One, that we would not have curtailments or furloughs on this campus, other than the usual kind of holiday closure, and two, that we would not have COVID-related layoffs between now and the end of the fiscal year. And hopefully by then, the pandemic will be mostly over.
Thank you, Nancy.
Yeah, and I thank you. And I do want to echo what Pierre said, that we've been very fortunate in having, I think, very rapid and strategic fiscal responses right away at the beginning of the pandemic that placed us institutionally in a good place. And so that has allowed some of these other decisions to play out the way they have. So thank you for that, Pierre, and others. And then in terms of terminology, yeah, I think these terms are very confusing, and they sometimes are used with less precision than we would want, which is completely understandable because they're not sort of plain English. But curtailment really refers to the operations not working. So they are curtailed, they are shut down. So when we think about the curtailment period over the winter break, for the most part, campus operations are curtailed, meaning that we're not conducting those operations. Now, there are exceptions for folks doing essential work, and their work is continuing, and we're very grateful for them keeping things running. But for many of us, we can take those days off. We can get a very much needed break and pause and hope to have some time to celebrate, even if it's not in the traditional way that we did so. The term curtailment really means the operations are not are curtailed, are not working. The furlough is a different term that sometimes gets intermingled, and the furlough means something else. It means people are off work and off pay. And so, as Pierre said, we're in a very fortunate position at UC San Diego in that we're not looking at implementation of any additional furlough other than what is our very standard traditional approach around what's coming up for our winter holiday. So it's great to have that time. I think it's a great outcome for us. And please let me know or let somebody else on my team know if you have any questions, because I do appreciate that we got different messages from Office of the President, and it seemed to use the terms in ways that may have engendered a bit of confusion.
Great. Thank you, Nancy, for that explanation. So I want to note, we're getting close to 5 o'clock. We'll be taking questions here in the Q&A until 5:15 for those of you who are able to stay with us. So I just wanted to let you know that we're not in a rush. So Gary, I'm going to send this next question over to you. And the question is, as more staff return to campus, what will staff need to know about what will be different? So for example, one-way traffic would be something different that they would experience. So in addition to wearing masks, hand washing, is there anything that staff can be doing proactively to keep everyone safe?
I think particularly in areas where there are doors that are locked, exterior doors, some of our research buildings, Leech Tag as an example, has systems on the doors. Please let those doors close and lock the way they're supposed to. We've found quite a few folks in buildings that don't belong there, and we're trying to do the best we can to keep the campus safe. We're also concerned about some of the hits in the wastewater, because we're really trying to figure out who's involved with it. And it's really important to make sure that those who belong in a building are there. Those that do not belong shouldn't be. There's also quite a bit of construction on the campus, as many of you know. Many of the streets are having detours at the least. The Voight Bridge is currently closed for all traffic, and it'll be closed for several months. There's a new roadway into the medical center that has been opened and closed, but most importantly, traffic has been allowed to go through even during the construction. So there'll be a few new traffic patterns, certainly on the east side of the campus, as well as on Gilman. And there's a project that's about to start in the theater district. So that would be Revelle and near the La Jolla Playhouse, where fencing may go up as early as next week to start a major theater district housing project that will hopefully be completed within the next 18 months. So the construction has been ongoing. In some respects, the virus has allowed us to move things a lot quicker than we had hoped to do with thousands of people around. So we have just limited traffic, and we certainly have quite a few resident students, but their needs have been addressed. And I think transportation has certainly provided services to keep our students safe and most importantly, to get them where they need to be. So I think the traffic patterns are the most important, as well as just making sure things that should be locked remain locked.
That's great information. Thanks, Gary. All right, so Nancy, next question for you. With a vaccine on the horizon, what's the current thinking about the new normal as it relates to the ability to work remotely after COVID measures and restrictions are lifted?
That's a great question, Hallie. I know in prior town halls I've mentioned that we are very actively looking at reimagining the workplace. So after COVID, when we're not constrained, we hope we're not constrained in the same ways that we have now. We really have incredible opportunities to think differently about how do we engage in the physical workplace? How do we learn lessons from this forced experiment for many of us, moving quickly and without, a high degree of pre-planning to fully remote work. We've been much more successful in remote work than we anticipated. The experience of our employees around remote work, as reflected in the Staff at Work survey, is overwhelmingly positive. Although, having said that, I want to acknowledge and recognize challenges that do arise from remote work. The experience reported by supervisors around remote work is overwhelmingly positive and reflects the supervisor's view of employees being highly productive in a remote work environment. So certain kinds of things that we experienced and were just sort of taken, I think we took for granted is oh yeah, you have to spend 3 hours a day commuting to come into work every day during heavy rush hour traffic. You have to fight for a parking place every day, Monday through Friday. That's just the way it is to work. I think we've seen that that's not necessarily the way it is. That is not necessarily something that we need to do. It's something that doesn't have a high value. It doesn't enhance the life experience of most people. And so, what are the real essential needs that we have operationally to have a highly effective workplace? What are the ways in which we ensure that our campus is vibrant, that it is a beautiful destination campus, that we serve our students, we have the commitment and sort of excitement around our mission and vision, and how does that tie into being an employer of choice, an employer where we can meet employees where they are, embrace innovation, use technology, and be environmentally sustainable, think about our use of our physical space and capital construction costs and our real estate to be again, used in a way that furthers the mission and vision of the university. So there's a lot in play. There's a lot of work being done around how do we really learn from the positive aspects of the experience. We also know there are challenges with remote work in terms of how to connect differently when you can't stop by and say to a colleague, hey, can you grab a cup of coffee with me? How do we translate that into a remote environment? How do we onboard employees if they haven't met their coworkers? In what ways might we be looking at a hybrid model rather than returning kind of to a status quo modality that we had before? So I think that we will certainly take advantage of the things we've learned during this period, and certainly want to be in a place where these very important priorities are really clearly articulated and delineated and thought through, and that the campus leadership, the vice chancellors in their areas will be tasked with and will be, I think, excited by the possibilities that arise from thinking differently about the workplace. It's not a one-size-fits-all answer because we have such complexity of workplaces and different work operational needs, but there's certainly room across the board for a recognition of the value of flexibility, work-life balance, use of technology, and kind of thinking differently about what is our physical relationship with our workplace and how do we stay connected and engaged with our work differently.
Thank you, Nancy. Great. All right. So the next question, Elizabeth, this one's for you, and I'm going to paraphrase just a little bit. So we're hearing from administrators, staff are hearing, take care of yourself. We're hearing about work-life boundaries. The work will always be there. You have to make sure to focus on yourself as well. But how do we balance that with the support that faculty need from staff? And how does staff have those conversations given everything that's going on right now?
Yeah, I certainly agree that given how stressful the pandemic is for everybody, that it is really important to take care of personal well-being, and I certainly reiterate that to my team. I think that if most of the work that all of us do, including me, can be done on a slightly slower pace, and the world won't end. It really won't. No matter how anxious I may feel about getting my work done, if there's a delay of a few days, it'll be okay. And so I think it's important for us all to internalize that. And if, say, for example, a faculty member is anxious about a deadline, and if a staff member is, finding they're going to need to take a bit longer, a supervisor can always help with the conversation if the staff member doesn't feel comfortable talking with the staff member directly, with the faculty member directly, or if the faculty member isn't quite hearing things, or a supervisor might be able to find somebody to help so that together it could get, things could get done. There are always a number of ways to address these things. And I just support the staff in taking care of themselves and their needs, because we want you healthy and we want you here for the long run.
It's a great answer. Thank you so much, Elizabeth. So here's a question I'm going to pose to the whole group that came in from a staff member, which is, how do we build community virtually? So I'm wondering if any of the leaders on this call have examples to share, maybe anything they've seen in your portfolio. Just any thoughts about that? I see Elizabeth, hand up. All right.
So I had been to a number of attempts at having a Zoom party that, hadn't really worked, were kind of awkward. And then my staff arranged a little gathering for us, an end of the quarter gathering. And one of the things that they did was have it was a holiday bingo card. And each square in the card was a little statement about, like, I'm already sick of holiday carols, or my family tradition is. And instead of really playing it like bingo, it was used to kind of kick off reminiscences, stories. We told stories about our childhoods and things like that. And it brought an incredible sense of getting to know one another, feeling like we were all just people together, taking a moment together. And so things that encourage us to share stories, I think, can be really powerful.
Yeah, I agree with that. We had in human resources, we shared the idea, or stole the idea a little bit from the Staff Association, but we had a human resources talent show. So it was totally fun. And not only did we see talents, but we got to see little bits of, other folks' families, if they performed with family members. And it was just a really special time for us all to get to know each other. So any other thoughts from the group?
Yeah, I think I love what Elizabeth said. And I think the thing too is about sort of building community in every interaction that you have with whomever you're interacting with on Zoom, being your authentic self, like letting your dog interrupt the conversation and that be a natural thing. Letting your daughter, my daughter, she will come in often because it's very important for her to ask for a piece of gum in that moment, and just letting it happen because people, need to see that sometimes. The other thing is, like, do things that are unorthodox, play Cahoots online, or just get together for an unscheduled, like an agended meeting where everybody's just together, and things that pop up, you can talk about what's going on. Someone might just play music and enjoy that, but do something that's natural for your group. Don't force things on them. Like, if they don't like cooking classes, don't make everybody do a cooking class. If they don't like art, don't make everybody, do art together. Like, if they're not an artist, ask them, what are the things you're interested in? What makes you, be entertained? The things that you would do in person, do that on Zoom, and then figure out ways to bring that to the Zoom life. So it's really just about being, like, available and open for folks.
One other thing that we've used that I think provides a way for people to participate where they don't necessarily want to raise their hand and speak if it's a larger meeting, is to use a Mentimeter and ask a question. It creates a word cloud. And I'm telling this to Hallie, and I don't need to tell it to Hallie because she's the expert in doing this. And we've used it a number of times in our HR all hands huddles, but it really creates a collective picture of what people are feeling. It could be a question about what's on your mind right now. What are you looking forward to? It's a way of kind of sharing together, and you see it live build out. So it's a very interactive and visual process for a larger group that I'd really recommend exploring as well.
Yeah, I agree. It sparks conversation as well in our group. Gary, I see that you've got your hand raised.
Yes, one of our groups, Public Records Office, had a virtual lunch with real food. So what they did was they ordered pizzas for the group, and pizzas were delivered, and they all had a meal together virtually. So it was well received, and they had a really good time.
So I'm hearing it takes some creativity is what I'm hearing from around the group, and talking to each other and see what folks are interested in doing. All right, so we've got just a couple minutes left before 5:15. So my last question would just be any parting thoughts. We're at the end of 2020 here. Any words of wisdom looking back that anybody might want to share?
I'd like to share, I don't think any of us could have predicted, there are numerous aspects of this year that have been incredibly difficult and painful and challenging. And we wouldn't have been able to predict that. And I think it's also true that we have seen, and our staff at UC San Diego have really seen ways of extending support to colleagues that are unprecedented, a way of acknowledging people's, real life, situations, which can be, deeply challenging, but to recognize how I think we form a community. And to me, the workplace is always part of, it's not just our livelihood and the way we support our families, but it is a source of our identity, and it's a source of our community and connection. And I feel that this time we've been through has really, for me, personally, I've experienced that as really enhancing and kind of highlighting the importance of those aspects. And I feel that that's true for many of us. So I think that that has a real beauty and value to be acknowledged.
And since Pierre, I would echo that. The good news is there are only 15 days left in 2020, and for many of us, we won't miss it. At the same time, there is a lot that we can be proud as a community. I was terrified when the pandemic started, and we're finishing the year with a campus that has remained mostly very, very healthy, that has mitigated what could have been a significant economic and social cost, that has kind of taken care of each other, that has come together very collaboratively. To pull together the Return to Learn program, to perform 100,000+ tests, to do everything that we have done to keep students, kind of faculty and staff safe. That means a lot of people have been working really, really hard and very much with each other across many, many parts of the organization. So I've never seen so much interaction between administration and faculty and healthcare providers and specialists on all sides of the campus. So I think there is a lot to be proud, and it will make us stronger and even more resilient as a campus.
Elizabeth, did you want to share something?
Yeah, I wanted to agree with what Nancy and Pierre have said, and just add that I've been so delighted to see new collaborations that came together, even to do familiar things. We're doing some of them through collaborations that didn't exist before, like the way that we recruited new students in the spring through a virtual Triton Day, or the way that we welcomed students to campus at the start of the fall through the virtual weeks of welcome. And those brought together people and groups who had done things more separately before, but suddenly saw it was a great chance to collaborate and do something really special. And that's been wonderful to see people reach for that chance to do something special and meaningful and joyous together.
Great. Well, that brings us to our time today. So I think that's a really great note to end on today. So I want to thank all of our panelists for your expertise and insight for sharing today. And I want to thank all of the folks who joined us today. Again, some of the questions that we didn't get answered, you'll find on the Return to Learn website. And other than that, I send you best wishes for a great end to 2020, and we'll see you next year.